morning, everyone. We just wanted to make a little video for you guys with some of the most popular questions that were asked throughout the therapy process to help everyone become more familiar with our practice. Dr. Davis, tell us about why you started Virginia Vision Therapy Center.
Well, I started this practice because I wanted a place where many kinds of visual problems plaguing people could be addressed and treated successfully. Kids who have perhaps an eye turn and they're only 2 years of age, kids who are autistic and have issues with not knowing where their bodies are in space and they can't fixate very well, kids who are normally very happy but they have serious meltdowns doing homework, people who have issues not getting back to work because of a recent head injury from a car accident perhaps. And so I really wanted a place where those kinds of issues could be addressed. I also wanted a staff that was willing to serve, and last of all, I wanted a very happy place to work. I wanted people to enjoy their work. I wanted teamwork, a teamwork spirit, and I think we've accomplished that here.
Thank you. And Dr. Carlyle, tell us why you chose to become a developmental optometrist.
Well, I didn't originally choose to be a developmental optometrist. I had been working in my career for about 15 years as a primary care optometrist. And when I had small children, my younger son had a left eye that just every once in a while I would catch turn in. Probably wouldn't even catch it if you weren't an optometrist, but I would see that little eye go in and I would bring him into the office and I'd check him out, nothing really significant turned out, so I kind of didn't know what to do with him, so I figured I would take him to who was and is still the expert in the area. So I brought him to Dr. Davis's office, and he explained what was happening and gave us some options for treatment so that we could catch it early and steer his development, let's say. And in the meantime, we had a conversation about another one of my children who had some vestibular issues that I didn't even realize could be visually related. And we looked at that as well. So from there, I went and took some advanced classes. My mind was further blown, and I haven't looked back.
Wow, that sounds good. Dr. Johnson, tell us why this practice is different from other optometry practices.
So I worked in primary care optometry, a couple of practices in Mississippi and also a few places here. And in those practices, I was very eyeball-centric. In other words, I was looking at the eyes as an isolated system, mainly worried about what power of glasses or contacts to use, and looking at the eyeballs themselves, and are they healthy, or are there any eye diseases. Very rarely did I look how a person's behavior or their whole body systems integrate into their vision. And I like about working here is that we take a step back, we slow down, and we look at how a person is using their whole body systems and how that integrates into their vision. And we look at the different stages of development that they're in and also how that is related to their vision. And so we're looking at how the person is behaving with their vision.
That makes sense. Dr. Davis, what is vision therapy?
Well, vision therapy is a process that is optometric, first of all. It's well researched, and it's a treatment program that's designed to give the participants feedback. So as they're doing a particular activity, there's a lot of feedback, and so they know exactly what they're doing. It's also a program where there's a lot of novelties, meaning the person can be really engaged and enjoy what they're doing. It's a process that takes perhaps 9 to 12 to 15 months, and there are periodic follow-ups with the doctors to make sure that we're on track. And lastly, we want feedback from the families or from spouses or other people who are close to that individual to really get a good idea of how they're proceeding. And so far we've had great feedback, and it's allowed us to grow beyond what we expected.
That's good. Dr. Carlyle, what can patients expect when seeking our services here?
Okay, so the first thing they can expect is to call and have some time scheduled with our intake or triage specialist. And that phone call will be a good 20 minutes where we're really trying to sort out what the visual issues are, decide if this is the right place for them, and also to help tailor the right type of exam. So after that, if we decide that indeed this is the right place to look into their visual problems, we will schedule an exam. The exam will usually consist of a pretty good chunk of time with a doctor, usually close to an hour. If it's a child, they'll also have some additional time with a doctor's assistant. And during that exam, we're really looking at what the eyes are doing, how they're moving, how they're working together, how the brain is processing that information. And then we wrap it up and provide a complete assessment of visual function.
That sounds good. Dr. Johnson, what is our mission here?
So our mission is, after a patient is done with vision therapy, is like, for instance, if a patient has had all these meltdowns because they couldn't use their eyes as a team on paper, to where now they're no longer having those meltdowns, that they can use both their eyes together efficiently. Or if they had a high level anxiety because they just didn't know where they were in space and had very poor spatial awareness due to deficiencies in their vision, that they now feel very stabilized and they're much more calm because of that. And to quite put it simply, our mission is to simply and humbly serve our community.
Thank you. Thanks, docs, today, and hopefully this helps everyone feel a little more familiar with our practice before coming in. Thanks for watching.